So this is our leg model. I know you've seen this before. I'm going to start up here at the top. This is the pelvic region because we have quite a lot of nerves and arteries and even a vein that you should know. Starting with our artery up here. Notice we've got an artery that's going to split. So before that split, this is the common iliac artery. After the split, this part that is going more down towards the leg is going to be the external iliac artery with the external iliac vein right alongside it. But the part that's going deeper into the pelvis is the internal iliac artery. And then there are several branches here. You do need to know them, but I promise they're not actually as confusing as they look. This first one, so it's the most superior, this is the superior gluteal artery. Now if I rotate this around, you see it coming out posteriorly right here, just above piriformis. So if you remember that muscle, that's piriformis. Now notice, tucked away right here, there's another little artery. That's the inferior gluteal artery. Now I'm gonna rotate this back around. That's coming from right here. This is the inferior gluteal artery. The little branch that is inferior to that is the internal pudendal artery. And then the one over here is the obturator artery. So that's gonna go through the obturator foramen. It is sitting alongside the obturator nerve. And I also want to point out where these nerve contributions are joining each other. That is the sciatic nerve. I'm going to rotate this just a little bit so you're now looking at the anterior aspect of the leg. Here is the femoral nerve, and you can actually follow that part of the way down. And remember, these were our external iliac artery and vein. Well, once we pass under this is called the inguinal ligament. You saw it in your last unit. We're gonna get a name change after they pass beneath that. Here, we are looking at the femoral artery and the femoral nerve. Or, sorry, not the femoral nerve, femoral vein. It is blue, after all. We've got a little branch right here that's going to be representing the great saphenous vein. Now notice we also have more arterial branches in here. The one that is deepest right here is quite hopefully, obviously, deep femoral or profunda femoris if you prefer, if you want to be fancy. We've also got the lateral femoral circumflex artery right here. And notice it has a branch going inferiorly and a branch going superiorly. Now as I move a little bit more down towards the knee, I just want you to notice these branches that are coming out around the knee. Those are all genicular arteries. So let's move posteriorly because we got more going on back here. There's that sciatic nerve that I already talked about. Now sciatic is going to split into two different nerves. The one that is going laterally right here, and you're not seeing it continue down the back of the leg, that is the common fibular nerve. The other one that's continuing down the back of the leg, that is the tibial nerve. Now, common fibular is going to branch itself. So I'm going to turn us back anteriorly here. It's got two branches, one that's more superficial and one that's deeper. This one that you're seeing here, that is obviously the most superficial, that is the superficial fibular nerve. If I take this piece off, we also get back here. Notice there's one right up against the tibia. That's the deep fibular nerve. There's a little bit of superficial fibular right here. So we are not seeing where they actually split, but we're seeing the result of that. And so superficial fibular is actually going to provide most of the innervation on the top of the foot, with the exception of this little branch here between the first and second digit. That's actually deep fibular that you're seeing. Now let me move posteriorly again. Sorry to do so much rotating for you. I hope it's making sense. So remember, we have sciatic branching into common fibular nerve and tibial nerve. The tibial nerve is going to continue down to the bottom of your foot, but this vein and artery alongside it, remember those are coming from the femoral artery and vein, but once we pass through this structure, the adductor hiatus, we now get a name change. This is the popliteal artery and vein. And there's those genicular arteries. So you have superior and inferior genicular arteries. So our popliteal artery is going to come down, and then we're going to get a branch coming off of it. So here, basically we're getting a split. What continues down is the posterior tibial artery, and what splits off right here is the anterior tibial artery. We'll look at more of that in a minute. Notice there's another branch beneath that, that is the fibular artery. And I'm gonna spin this around one last time so that you can see there's that continuation of the anterior tibial artery. So just to remind you, we've got the deep fibular nerve and the anterior tibial artery right alongside each other. So those are the nerves, arteries, and veins that you need to know on this leg model.